On call this morning, while scientists still don't know the exact causes of colorectal cancer, WDSU medical editor Dr. Corey Hebert says there are known factors that determine everyone's risks.
Over 150,000 Americans are diagnosed with colorectal cancer annually. But what exactly causes cancer of the large intestine or rectum? Although the exact cause of colorectal cancer is not known, there are identifiable factors that increase a person's likelihood of developing cancerous growths in the colon and rectum. Most cases of colorectal cancer begin as polyps. Damage to the body's chromosomes, which can arise without any clear reason, can lead to the uncontrolled growth of cells, which then form these polyps. Although colon polyps start out benign, they can become cancerous with time. Chromosomal mutations which lead to polyps can also follow from hereditary colon cancer syndromes, which are passed from parent to child at conception. There are 4 hereditary syndromes that can cause these damages in the chromosome, each of which is present at birth. But even without a hereditary syndrome, people who have a sibling, a parent, or a child with the disease have 3 times the normal rate of developing colorectal cancer. Colorectal cancer is also linked to several diseases, notably ulcerative colitis. People with ulcerative colitis experience severe inflammation and ulcer formation on their large intestines. After having the disease for 8 years or more, the risk of colon cancer rises dramatically. People who have the cancers of the pancreas, breast, ovaries, or uterus are also more at risk for developing colorectal cancer in the future. Studies have shown that colorectal cancer may also follow from certain lifestyle factors, particularly diet. Consuming many foods high in fat, such as certain meats, dairy products, and cooking oils, may hasten the development of colorectal cancer. This may be because of the breakdown of fat, which can lead to the formation of cancer-causing chemicals or carcinogens. Conversely, people who eat high amounts of fiber, such as whole grain breads and also vegetables, may have a lower risk of developing the disease, as fiber helps rid the bowel of carcinogens. It's also possible that exposure to high levels of environmental toxins, including chlorine and nicotine, may contribute to the development of colorectal cancer. Despite these known risk factors, up to 80% of colorectal cancers occur in patients with no family history or known cause of the disease. Everyone aged 50 or older should get screened. But if you have a family member with colon cancer or a colon cancer syndrome, or if you have a colon syndrome yourself, you should be screened sooner. Talk to your doctor about your options. I'm medical editor Dr. Corey Hebert with your Weekend House Call.